Excuse me. There's another crisis. The healthcare system, you've heard it's broken. Well, let me tell you, 4 months in the hospital is a lot worse. I thought I knew. It's a lot worse than you knew. I'm here in excruciating pain, my life ruined, dying from a mystery disease, along with a lot of other roommates I've had, both here and in a nursing facility the last 4 months. Can't walk, pneumonia, immune system attacking herself. That's me. I'm dying from inflammation. Your immune system attacks itself. Stuff causes that. A reaction to a drug, a reaction to a vaccine. Rare for prior vaccines and not so rare with other vaccines that we've had throughout life. Take a guess at which ones, huh? Inflammation caused by disease, sepsis, genetic disease. Yeah, well, I've had my blood work done so many times, and chest tubes and biopsies sent out to the Mayo Clinic and world-renowned labs. I'm just dying from inflammation. My immune system is attacking itself just out of nowhere. No cause. 4 months in the hospital, life ruined. 160 pounds, working out and modeling to this. And diabetes from the steroids, because there's no drug to treat an unnamed disease other than steroids. Guess what? Fentanyl crisis, drug addiction, doctors running around scared to give you pain meds. I'm yelling and screaming in pain, begging for God to kill me. On a scale of 1 to 10, I have level 10 plus pain. I'm in tears all day and all night long. Then they won't give me narcotic pain medication or anything that works. It's not narcotic because it's too addictive. I have no addiction problem, no history of it, and I can prove it on paper. And even if I did, who cares? I'm dying. Who cares what somebody's past is at that point? They gave me a muscle relaxer to relieve the spasms that happen when I slept to eat, or when I lay back to keep me awake all day and all night. I haven't slept in a year. Sleeping medications are controlled substances. We can't give that to his control. There's tight laws on that. I finally get a muscle relaxer. It relaxed my muscle. I could sleep last night. This morning, the pain management doctor said, we're going to take that away from you. I don't like how addictive it is. Why? I don't feel high. I don't feel tired. I just felt the pain go away. And even if I did feel a side effect, as long as I'm not vomiting or dropping on the floor, who cares? I'm not here for a party. And this pain is permanent till my death, so who cares about the addiction part at that point? Not that it would happen anyway. A small handful of people end up that way. Where I get my coffee where the homeless were piling up like you've never seen before 4 months ago. A lot of addicts I talked to, none of them had it from a surgery. It can happen, but it's very rare. But look out there, 2 years of pushing addiction and fentanyl crisis, stricter laws, cracking down on doctors. I mean, run around scared about being prosecuted and thrown in jail. Look, the homeless and drug problem, which is tied in together, is increasing. It continues to. It hasn't got better a bit, not an ounce. But patients being kept for pain medication and sent home this way and sent back to the hospital in agony. And I'm hearing that it's going to start affecting cancer patients who, as of right now, get whatever they need. They're not the only ones that experience extreme pain. And unfortunately, my death has taken a lot more than 6 months or 3 months. Not to sound ungrateful. How long is this pain going to go on? 2 years and counting now. And 6 months excruciating. And the pain doctor's worried about how addictive, what is it, a soma is? Is that the name of the... Something I felt no effects from except pain relief. That pain pill is so tiny. In addition to that, you don't feel anything from that either, meaning no pain relief. No side effects either. And he's worried about addiction. They got doctors running around scared. Don't punish the patients. And it's happening a lot for those of you who don't know. Stop it. It goes well beyond a broken legal system, but lawmakers are on this too. You're going after the wrong people. And you're not making the addiction crisis out on the street fentanyl crisis any better. Nobody's succeeded at that. And right now it's excelling, it's getting worse. You're really failing at it. I don't think we'll ever solve it. But stop punishing the patients. So I can get a little less pain and die a little more. a little more peacefully than a lot of other people, millions of people. Knock it off. Go about this addiction crisis another way and stop scaring the doctors and punishing the patients. Doctors, nurses, patients alike. No, barely anybody's talking about it. Everybody's afraid of their career and everything. I'm not saying to walk out on your patients and leave them sitting alone in a hospital, but somebody better go out and do something and be heard. Because we're suffering in the flesh. Tears, blood, flesh. It don't matter. You're black, white, gay, straight, bi, Republican, Democrat, Channel 7 News, Fox News, don't matter. This is in the flesh. It doesn't discriminate. If it hasn't visited you or your family yet, and this keeps up, it will. Mark my words.